So your doctor has given you a prescription for diabetic shoe wear. Unfortunately, to get your footwear covered by insurance, there are a few extra things that need to happen before we can provide the footwear to you. The last thing any of us want for you is to get stuck with an unexpected bill because of an insurance denial. Insurance companies will only cover diabetic footwear if you are diabetic, so they will need proof of this. That means that not only do we need information from whatever doctor prescribed your diabetic footwear, we also need information from the doctor who manages your diabetes. Simply put, we need to submit 2 items from each of those doctors to your insurance company for a total of 4 pieces of information. This is so that they will pay for your diabetic footwear. From the doctor who prescribed your diabetic footwear, we will need a prescription for the diabetic footwear and that doctor's documentation from your appointment with them. From the doctor who manages your diabetes, we will need a diabetic shoe form filled out, as well as their documentation of their last appointment with you. So again, that's number 1, a prescription from your prescribing doctor, 2, documentation from your visit with your prescribing doctor, 3, a completed diabetic shoe form from the doctor who manages your diabetes, and 4, documentation from your most recent visit with the doctor who manages your diabetes. Included in the email you received are links to the diabetic shoe form that needs to be filled out by the doctor who manages your diabetes. Often the documentation from the visits with both doctors can be retrieved through your patient portal, and if not, you can call their offices and get what you need. When you come to your appointment, make sure you have all of these items as well as your insurance card and ID. For your protection, we cannot see you without all of these items. We also have a link to all of the paperwork that needs to be filled out before your appointment if you want to get that done in advance as well. We understand that it can be frustrating and burdensome to have to get all of this information, but unfortunately in the medical field, we must follow the rules set up by insurance companies or they will not pay for services. In the end, we want you to have the diabetic footwear that you need and for it to be covered by your insurance. So hopefully all of this will seem like a small price to pay. Thank you so much for listening, and if there is any confusion as to what needs to be done for your diabetic footwear to be covered by your insurance, please call American Orthopedics at 614-291-6454, extension 104. You can also send an email to info@amerortho.com.